Hi, Dr. Pelto here. I'm going to go over a question from a patient that sent this on YouTube. If there is a granuloma, does that mean that only a surgeon can help and not a regular podiatrist? It really depends on where you are living. Podiatrists here in the United States, we deal with bigger conditions like this, and I'll explain in a second what a granuloma is. In other countries where a podiatrist only takes care of ingrown toenails and does not have the ability to numb up the toe, you may need to see a different doctor, such as a surgeon. But if you're in the United States, you can come to see a podiatrist and they can take care of the granuloma. What is a granuloma? Well, an oma, okay, I think it was like an oma is a tumor. So it's a tumor or an increase in the tissue that has something that we call granular tissue. Granular tissue is this red tissue right here. You can see it looks red on the side of the nail, and it is very swollen. Another word for a granuloma is proud flesh. When the flesh gets all elevated and red and painful, this is caused by a nail digging into the skin. When a nail digs into the skin over a period of time, your body, it's going to send more blood flow to the area. And because of the increased blood flow, it's going to create all of this excess tissue. If you didn't have the nail growing into the edge, you wouldn't have that extra tissue in there. How do you treat a granuloma? I inject the base of the toe with an anesthetic. Usually I use a combination of 1% lidocaine and 0.5% marcaine, about 3 milliliters or 3 cc's. And I give it a long time to numb up. That might be 3 minutes, 5 minutes, because a granuloma or an infected side of the nail many times doesn't take very well with an anesthetic. So even if I do an anesthetic, many times it still is not numb completely. Once it's numb, I take out a little line right here on both sides of the toenail. I take out this little line, this little sliver of nail all the way back to the base. And I sometimes remove this granuloma. What you have to realize is when you remove a granuloma, it's going to bleed profusely. After I remove it, I will put on something that will stop the bleeding. We use something in the office called selenocaine, and I apply this to the edge, and the granuloma usually heals on its own when you take away the side of the nail that's causing the problem. So that's how you take care of a granuloma, and that's who can take care of it. If you found this beneficial, I'm going to include some other videos here about ingrown toenails with some of the other treatment options for ingrown toenails. Once again, I hope you find this beneficial, and please subscribe to this channel.